Hello and welcome to the medical school interview course. My name is Dr. Inaam. I'm an experienced doctor in the UK and co-founder of StriveMed. I've put together this comprehensive interview course for anyone who's undertaking a medical interview to become a medical student and a future doctor. We've tutored a wide range of students in order to succeed in their interview, and we know exactly what the recipe is to succeed. We uncover a variety of different skills, such as the various mindsets that you need before you even go into the interview process. We explain the different types of interviews and the scenarios that you may be facing and how to excel in each type. We explain how exactly in depth to demonstrate an understanding of the challenges of medicine and also demonstrate your motivation for medicine. We also go through the key knowledge-based elements that you need for your interviews and that you could be asked about. We explain in this course how to let your personality skills shine through and wow the interviewer. We also discuss work experience, and we outline how to maximize the work experience that you've done in order to impress the examiner. Join us on this course, which prepares you for your dream career in medicine as a doctor. Hello and welcome to your interview course. My name is Dr. Inaam, and we'll be teaching you everything that you need to know in order to get into your dream medical school and pass your interviews with flying colors. If you want further advice, further coaching from us, we're more than happy to help you directly. You can just contact us on strivemed.co.uk. You can partake in one of our packages as well to get one-to-one tutoring and mentorship from us. We have a wide range of tutors. We have a lot of medical students. We have doctors working with us as well. So the first chapter which we're going to discuss is all about the key mindsets which you need. And this is something that you adopt prior to actually attending the interview and prior to even preparing for the interview. This is something that you need to know as soon as you get the email that you've been invited for an interview in order to give you the best possible chance of success. Okay, so the very first mindset that we need to internalize and understand for the interview process is that you do not need to be a doctor in order to succeed in this interview. So that sounds very obvious, right? Of course, we're going into the interview to become doctors. But oftentimes the students, they start to think that we should be thinking in the exact same way as doctors already, and that we're expected to give answers which a doctor would, when in reality it's not exactly like that. This kind of mindset would only serve them to put too much pressure on themselves and not answer things in a very logical, calculated way, which they should be doing at this stage in order to demonstrate the extents and the boundaries of their knowledge. Okay, the main thing which you need to understand that they're looking for in an interview is that, is this person ready to become a doctor? Okay, and that requires a variety of different things, but the main things is this person humble enough in order to teach, and such that he will learn and gain the knowledge and develop into a doctor? And does he have the right thinking patterns, the right thinking processes in order to acquire that knowledge to become a doctor? Okay, and this is something that you will develop over the time within your curriculum in med school. So just to summarize, you need to be someone who's humble enough to teach to become a doctor, and you need to demonstrate that personality throughout the interview. And you have to be someone who understands the realities of medicine, who really has a passion for it and is thinking in the correct ways in order to succeed. The next point is that we have to work on eliminating imposter syndrome. So imposter syndrome is defined as the self-doubt of skills, intellect, and accomplishments, and it's commonly presents upon high-achieving individuals, as you would be in order to have gotten to this position in the first place. Now, it's important to understand that the previous point which we've discussed is that you do not need to be a doctor in order to succeed in this interview. Is very, very important in order to eliminate imposter syndrome. And you have to internalize the fact that you are the right candidate. You've taken all the right steps. You've been blessed with this opportunity to succeed in the interview and to have an interview for a medical school. That's something very, very prestigious in its own right, and that's an achievement not to be taken lightly. And the reality is, you really need to, they're not trying to trick you out. The fact is that they want you into their med school, okay? And you just have to display a few key skills and you're over the line, okay? So the fact that you've been invited indicates that you are the right candidate. You've got the grades, you've got the skills, you've done the work experience, the personal statement, the variety of different entrance exams which you may have to do. And so that's something very important to reflect upon and realize that you are actually the right candidate and they do want to accept you. The next mindset point which I wanted to share with you is that confidence is something which can shape the mark scheme, okay? This kind of ties in with the previous point. Confidence can also be defined as the absence of anxiety or the absence of imposter syndrome would actually improve your confidence. If you believe that this is somewhere where you should be, somewhere where you belong, that you've done the prerequisite requirements, the training, you've taken part in this course, for example, you've done mock interviews, then you should be someone that's confident that okay, I've done my best, I've taken the means, okay, and whatever the rest is, that's up to God and that's up to Allah. With regards to the outcome, that's not really in my hands, but I've done what I needed to do. And the reality is that the confidence which you display in your answers, in your presentation during the interview, that can actually shape the mark scheme. So it's important to realize that these interviews are going through an abundance of interviews throughout the day, throughout the preceding weeks, throughout the preceding months perhaps. They're going through so many different interviews, and the fact is that they want to see someone that has some assurance in their answers, okay? And this is very interesting because you have to strike the right balance, because I alluded to humility earlier, right? So you don't want to be overconfident. That's something in medicine that's very, very dangerous. But at the same time, you don't want to be so timid that you're unable to make any decision. And this is something that as a doctor, you will have to strike the right balance. Why? Why is that? In medicine, there's something very, very important, which is to know and to understand the extent of your knowledge, okay? Let's say if someone's on a busy on-call shift and he's still a junior doctor, he has seniors there to help him. And this is the structure that they have within the medical system. When you're working on the wards, when you're working in the hospital, there is support, okay? There is support. And even as you climb senior in the ranks, there usually tends to be support as well. Like there's always, tends to be individuals you can discuss with, and kind of you can refer to different people. You have your registrars on call as well, senior to you, and you can ask for their help, right? Similarly, there's not just that. There's not just referring or asking your seniors for help. There's more acute cases where you really have to know the extent of your physical capabilities, which is, for example, let's say you come across a patient who doesn't have a pulse, they're not breathing. You've recognized the fact that they've gone into cardiac arrest. You need to call for help, yeah? It would not be appropriate. It would be overconfidence if you were to, in that situation, say that, no, I'm going to do it myself. That would lead to detriment of the patient, a deleterious outcome. So upon us is to realize that similarly in medicine, there will be cases where you will have to, for example, refer to the specialist, refer for senior help, see when the patient's very unwell. You will have to know the extent of your knowledge. Okay, so that's when the humility aspect comes in. But having said that, you have to balance that with the confidence that you're acting within the knowledge that you've been trained upon. So for example, the registrar, once you've bleeped the registrar and he asks you, what's the patient presenting with? Okay. And at that point, you don't want to be flustered. You want to be confident that you've done a thorough examination. Based on the level that you're at, you've done the appropriate steps. You've done the basic A to E assessment for the patient. You've analyzed what you think may be going on. You've analyzed what you think may be the optimal management plan, but you still liaise with a senior because you understand maybe you haven't seen many presentations of this kind before. Maybe it's something that you want to clarify with him, etc. Maybe it's something that's beyond your capabilities at this point in time, or you just need some reassurance and some support. So you have to show that you're acting at the appropriate level of your current position. So this brings me back to the main point, which is that confidence can shape the mark scheme, okay? So you have to be assured that you have shown the examiner the right frame of thinking, okay? And you often have to, sometimes you may be presented with problems in the interview setting. You have to show the examiners you're working out. It's the same as when you're doing a maths exam, for example, yeah? And we all had to do maths to some extent. And there's a big blank sheet of paper over there, and there's a small section for the answer. Why is that? You could just technically come up with the answer there and then, or just kind of, you can sometimes when you have drawings and you have shapes and all of these different things, you can kind of gauge what the answer could be. Is this line going to be 3 centimeters, 3.5? Sometimes they're not to scale, that's a different matter, but the key is in showing you're working out, showing your thought processes. Is this something that aligns with your current position as a student? And is it the correct thought process that can be expanded upon with the right knowledge in order to become a doctor later on? Okay, so when they see someone who has this right balance of confidence in the right areas, humility in the right areas, knowing the extent to their knowledge, but at the same time, not unfairly downplaying the knowledge which they do have and which they have worked upon throughout all of these years, then that's what makes an individual truly stand out to the examiners. The next point, which is very important to internalize, is that the interview is not too difficult, okay? There's going to be so many different courses out there, books out there, gurus out there, which you may see, which they want to overcomplicate the process. Okay, they want to overcomplicate the process, give you thousands of pages to read, get you to analyze each and every circumstance that may possibly come up. And these kind of approaches, these over excessive preparations may actually cause to heightened sense of anxiety during the interview, which can actually impair your performance. It may lead you to reach a situation where you think that, for example, you're in the interview, you're looking at all of these pages in the books, you're like, oh, I read this, oh, I can't remember it, what's going on. You have to realize this one thing: the interview does not work like that. You cannot just recall a script in your brain and then come up with that on the spot. The chances are there's going to be 100 different scenarios in those books, right? Are you really going to memorize the answers and learn the answers to all of those different scenarios? Okay, so the reality is that you need to learn a few key thought processes. Once those thought processes are understood, as I've been already explaining to you in the previous parts of this course, right? Once you internalize those ideologies, you will develop into the ideal candidate. You will develop into an individual with the ideal mindset in order to pass the interview and to succeed and excel in medical school. You will have the right thought process in order to apply these thought processes to the scenario once it's presented to you. Of course, you have to practice, okay, applying those thought processes, but the main thing is that you're not learning the answer in and of itself. What you're learning is the thought processes which lead you to the answer. Okay, so in summary, the interview is not necessarily you have to get it out of your mind that, oh, this is such a huge barrier, such a huge obstacle. The more you think like that, the greater the obstacle will actually be. Okay, and as I said, it will reduce your confidence if you actually think it's such a huge obstacle. It will increase your imposter syndrome if you feel like the rest of the candidates are all sitting here, I don't deserve to be here, what's going on, maybe I'm a fraud, maybe I'm not actually as clever as these other people, I've not had the same advantages in life. I mean, you could just look at our podcast, a variety of different podcasts which we've released on the StriveMed YouTube channel. You've seen people from all different backgrounds, people from not as advantaged backgrounds as others. You have people not doing the same activities as others, you know. For example, they may not have had all of those high-paying hobbies, like they may not have been able to do all of those high-paying hobbies which their parents may have been able to afford for other people. But for some people, it's mainly, you know, playing cage football, you know, things like this. It's like a different upbringing, right? The reality is that everyone has something to offer, and everyone has intrinsic values and intrinsic advantages as to why they would succeed as a doctor. So the reality is that you are already that individual. You just have to understand those skills in order to bring it out in the best way. The next mindset which I wanted to share with you is that they're not looking to catch you out, okay? They're not looking to purposefully try to make individuals fail the interview. There's not going to be some sort of it's very unlikely, but mainly they're straightforward questions, they follow the same pattern, and there is regulation in these interviews. Okay, so it's important to remember that. Whether you have a panel interview or an MMI interview, they are regulated, okay? You may think that, oh, I could get anything on the day, anything can happen. To some extent, yes, anything can happen, but you have to realize is that the interviewers are working within a framework, within a body which they've been given, okay? They have people watching over them as well, regulating over them to make sure that they can't go out of the boundaries of the appropriate interview style, of the appropriate interview nature. Okay, so it is regulated, it is standardized to that extent. Okay, so the main thing is to understand, again, it adds on to that previous point which I've made, is that please don't make this a bigger obstacle in your mind and don't paint it out to be bigger than it should be, okay, bigger than it deserves to be. Of course, it's a big step. It's a big step to reaching the med school of your dreams and reaching the career of your dreams, right? Something that you've worked so hard towards. However, the reality is they're not looking to trick you out on purpose. Okay, so keep this mindset in place, and that really puts you in a much better position to succeed. So the next mindset is that if you have a realistic desire, you will stand out. Okay, I repeat. If you have a realistic desire, you will stand out. So there's two elements to having a realistic desire, okay? Keep this framework in mind, realistic desire, okay? The term realistic exemplifies the fact that there are a lot of challenges in medicine and you have to understand what you're getting yourself into. There's a fact that there may be many things you have to sacrifice. We'll go into these kind of challenges in medicine because it's very important to understand this for your interview process and to display your understanding of this to a high level. Okay, that's what's going to help you succeed. Okay, so you understand both the pros and the cons of medicine. So with regards to the cons of pursuing this career, or I wouldn't necessarily say cons, but challenges that you have to overcome. And challenges is just a natural reality of life. It's something that you will have to go through for everything that you want to achieve in life. Anything good, you have to face an abundance of challenges in order to get there, right? But upon you is to have the resilience and to demonstrate that you have a realistic understanding. Okay, so if you have a genuine understanding, like you've gone through the thought process, you've gone through the life experiences in order to understand that this is what you want to do. And again, you may say I'm getting philosophical here, but these are the key tenets in order to understand, in order to succeed in your interview. The reality is that within the school system, till date, you may have not had as much time to reflect upon what it exactly is that you want to do. You may be influenced by various factors. Some may be even forced into doing medicine. That is the reality. There's a lot of cultural factors associated with this, factors related to family, peers, friends, pressure, peer pressure, etc. There's a lot of different factors at play here. Okay, but the reality is that in the school system, a lot of the times a lot of the students would be heavily focusing on the academic grades, right? And there's a lot of introspection which needs to be done. Okay, there's a lot of experiences of the outside world which needs to be done. But the main thing is that if you've had the prerequisite experiences, okay, which will really set you apart from everyone, because the reality is that majority, they may not have a true understanding, a true realistic desire of the positive points of medicine as well. So you have to have the adequate balance of understanding the challenges and the benefits, okay? And that comes through deep introspection and combining that with real world experiences. So then you take the pros of doing medicine, okay? And you are in a position where you can say that, yes, I understand the challenges, but this is something that I really want to do. And you have your reasons for that, okay? If that is real, that will shine within the interview, okay? So upon us is to do that, a lot of introspection, the mental work, and, really sit there and think. And once you've confirmed that to a really high degree, the higher you are in this understanding of your realistic desire, most likely the higher you'll score within the interview as well. So the next point is that you want to use appropriate skills before the interview in order to calm down. Okay, so again, you will have heightened anxiety, heightened nervousness, heightened activity of the sympathetic nervous system. Again, this is something, if you haven't learned about it extensively, you can research it. But you really want to calm down before the interview. This will really allow you to process your thoughts to a good level and communicate them in a calm way. Okay? We want to be calm so that we're able to not jump to an answer. We want to have answers that we've carefully thought of. Okay? What happens is that when you're nervous, and the fight or flight system is very, very active, what happens is that time tends to speed up. Your perception of time, things tend to go by very fast. Okay, so when the interviewer asks you a question, you may not be breathing calmly enough to actually understand what they're saying. You may think that you have to answer within the split second, so you may not have processed your thoughts in the adequate way. You may not have planned your answer in the adequate way. Again, I'm not saying that you're meant to stop there for 1 minute in order to plan your answer. But the reality is that this is something that presents, and these are microseconds, milliseconds, or seconds, a matter of seconds, right? But that determines a big impact on your answer. So you have to use the adequate outlets in order to make sure that you calm down before the interview. Okay, so this covers a variety of different things. So some things that you can do, of course, very important. You have prayer, you have meditation, you have mindful breathing. Okay, all of these things are very, very important to increase the parasympathetic nervous system and decrease the excessive adrenaline system overactivation. Okay, so things like exercise, things like slow cardio as well, that's something which will be beneficial for you, get you more alert in the appropriate way for the interview, okay? And the main thing is, once you internalize these mindsets, you shouldn't be nervous, especially the things which we've discussed earlier. You shouldn't be nervous. What I mean by that is you shouldn't be nervous to the degree that it hinders you significantly. Of course, there's a heightened sense of activation. It's going to be different, much different than you speaking to your family in the living room, having some tea in the evening, right? It's going to be different to that, and that's normal, okay? But we want to make sure, as I said previously, is that things are appropriately balanced, okay? So keep that in mind. Okay, so another important thing which will help you calm down is to understand that medicine is about resilience, okay? So medicine is about resilience. You will ride with whatever outcome is there, okay? This is something that's very important, the fact that whatever outcome is there, okay, you realize the wisdoms of certain things in your life, and you realize things that happen. You realize the wisdoms later on. It may not immediately be apparent. You may think that entry into this particular medical school is the best thing for you, right? But in reality, we have limited knowledge, okay? We have very limited knowledge. We can only see a pixel of the equation. We cannot see the entire picture, okay? So it's very important to not be overly fixated on one particular outcome. We have to understand that whatever the outcome is, it will be fine, and it's something that we take on the chin. Okay, this is something that also reduces the excessive nervousness before the interview. The reality is that you feel it's the worst case scenario. It may not actually be the worst case scenario, as I said. Okay, you may think that the worst case scenario is that the interview doesn't work out. Okay, first of all, who said that's the worst case scenario? Do you have objective evidence for that? Secondly, even if that were to happen, it's not the end of the world at the end of the day. You can still continue. There's still so many pathways, right? And the reality is, as I said, is that medicine is about resilience. I repeat that again. I'm going to say it 3 times. Medicine is about resilience. Medicine is about resilience. You will get hit on the way. You will take hits on the way. But the most important thing is not how hard you get hit. The main thing is how hard you can get hit and still come back up. You're going to take hits, whether it's on the wards, whether it's at work, whether it's at the desk when you're studying, all those long hours for the work, whether it's in the sacrifices that you have to make. Some exams in med school may not go your way. You may not get some training jobs which you want. The reality is, as I said, medicine is about resilience. Okay, so you're better off watering the plants on those mindset very early on in the process. Okay, water the plants on that mindset very early on in the process. Is only going to serve you in the best possible way. The next point is, of course, it's going to help you from a mainly mindset perspective. Of course, my understanding of the Islamic perspective is that you don't place too much power of the outcome on the interviewers. Okay, those are individuals who are operating, okay, their means for a particular outcome to take place, and you have to again be just pleased with the decree. You have to be pleased with the decree of God, of Allah. Whatever happens, okay, you believe that it's going to be for the best. Okay, you've done the right things. As long as you've taken care of your side of things, okay, between yourself, your relationship with God, your preparation as well, okay, then the outcome would be in your favor. Okay, so that should give you a lot of tranquility, put your mind at ease before you go into the interview. The next mindset which I wanted to share with you is that the interviewers, the examiners, the entire process of medical school, they're looking for human beings, not robots. Now, this may sound very obvious, but the reality is that the way that a lot of students are approaching the interviews, it's as though they think that the interviewers are looking for robots. They're trying to learn the answers. They're not giving any emotion in their speech to demonstrate their realistic desires for medicine. They're not using any facial expressions. They're not using their voice, using their hands appropriately. The reality is that medicine has so many soft skills associated with it. You're going to have to display your empathy. You're going to have to display laughter at times. Let's say if you have a child patient, you may have to communicate with them differently. If you have an elderly patient, you're going to have to communicate them differently. So the reality is that you have to react appropriately to what the circumstances are presented to you in the interview. You can't go with a robotic mindset because that will be very limited. You'll only be trained to deal with and respond to a very select range, a very select array of responses or programs which are dictated to you, right? Or programs which you have ingrained in your mind. You have to be adaptive. You have to be responsive. You have to demonstrate your soft skills. Give it your everything. This is the time to display all of your human skills. These human skills are then going to be important in serving others, helping others, achieving a positive impact on the lives of others. This is why you wanted to get into medicine in the first place, right? With a noble intention, right? So the important thing is to remember that you have to display all of these skills, okay? And that's what's really going to help you succeed. Okay, so first we're going to be analyzing the various different interview formats, okay? The 2 key ones which are used in the United Kingdom and also worldwide now, very common, is the multiple mini interview, okay? So the MMI and the traditional interview. So the first one we're going to cover is called the MMI, multiple mini interview. This is where you have a series of different stations. Okay, you'll have a booth, you'll have a variety of different booths which are there. Each one has one particular question or assessment. The assessment can be a variety of different types. Each station lasts a certain length of time. Usually it's under 10 minutes, usually around 8 minutes, okay? But you would have to check the specificities of your particular universities. Each examination offers a particular style of assessment, okay, and you'll have a prompt, you'll have something to read beforehand, and you have a very small amount of time to prepare as well. So in a traditional panel interview, you are interviewed by a series of professionals, okay, affiliated with the university. So they might be scientists, they might be doctors as well. You may also have students of the university itself as well who are interviewing you. So the panel can range all the way from one person to more than that, even up to around 5 people, sometimes 3. So you have to be prepared for that. And each individual university has their own particular panel style and panel arrangement, which they'll have. This type of interview would feel more like a conversation rather than a series of back-to-back questions. So it really does give you a chance for your personality to shine and to demonstrate your flair as well. So the panel interviews tend to be shorter as well. They can range anywhere from around 20 minutes, 40 minutes, sometimes longer or shorter depending on your university specifications. So the type of questions and the particular mark schemes varies from university to university, although there tends to be quite a lot of similarities between them, all right? So it's very important that beforehand you actually look at the particular university. They often release what exactly it is that they're looking for throughout the interview as well. So you can really maximize your preparation in that aspect and make sure that you had examples of everything that they're looking for. So the first piece of advice is that it's very important in this type of an interview to develop rapport with the interviewer, okay? And this is something that is very, very important as a doctor, especially working in the NHS. You're working in a multicultural workforce and you have people from all walks of life. Not only that, but you have different patients from all different backgrounds, building rapport, building within a very short space of time, building that comfortability, that familiarity, just kind of breaking the ice with another person. It's very, very important. And so it's very important to come across as open, come across as someone who's positive, friendly as well. And all of these things will go a long way to putting your interview on a very solid platform for you to advance from and show your skills in the best possible way. Breaking the ice is often very, very important in these interviews, and it can actually go a long way to developing a calm mindset, which is what we spoke about is so important earlier. As mentioned earlier, it's very important to be friendly and make that human connection between yourself and the interviewer, okay? So at the end of the day, we mentioned that our approach as applicants, okay, it shouldn't be as someone who's robotic, right? The same is important to remember for the person interviewing you as well. They're also human beings. They also have feelings. They also have, you can really build rapport, communication with them. So, it's important to humanize them, treat them as human beings and develop that layer of familiarity and be comfortable with the whole situation. So at the start, various things. How are you? Thank you very much for the opportunity today. Things like this. They may ask you, how was your journey? How was your day? How are you? These basic things are very, very important. Always greet them with a smile. Just be nice, be welcoming, and they're going to be the exact same for you as well, most likely. Now, in this particular type of interview, because you're only with the same set of interviewers for the entire length of the interview, you may get very, very panicked. If you get flustered, if you struggle with a question or something, you may think that this is something that you can't recover from. Again, the most important thing is to remember to do it gracefully. If there is a period where you have a mind block or you're struggling to analyze the question, again, you can always ask for a repeat analysis. I did that many times in my interview as well, just to make sure I'm answering the exact point which they're looking for. Another thing is to think about is the fact that if you do need to take a pause, again, as I said, in the MMI, make sure to do it gracefully. Make sure to explain that you just like to gather your thoughts. And this is often something that's very respectable and, it's not necessarily looked upon badly. The main thing is that you need to make sure that you still have that self-assured persona in the appropriate way, that professional approach, and you're not really like fidgeting or being so overly anxious, overly nervous, and then some interviewers tend to blame themselves and say, oh, I shouldn't have said that. They'll say these things out loud. Oh, I didn't mean to say that. Oh, I'm just a bit nervous, things like that. Just try to remain cool and just say that I'd like a bit more time just to analyze the question and to gather my thoughts. Just think through, and then you continue speaking. Now, in this type of interview, it's all about adaptability, right? So you'll all have different interviewers, right? While they'll have the same structure and the same framework, each human being is different. Each human being operates at a different level of the English language. They may have different commands of the English language as well, different accents, different speed of interviewing as well. And the speed is something very, very important to understand. And you often have to read the cues and see how much they're engaging with what you're speaking about. There may be different types of interviews within the panel as well. You may have one which is more engaged, one which is less engaged. Some interviewers may even try to throw you off a bit by doing various movements or whatever, but the point is to just remain very focused, remain calm, remain composed, and go through your answer in a logical, systematic way. To some extent, you can dictate the pace of the interview. You can slow things down with your speech. You can speed things up as well. But it's very important to take the cues from the interviewer themselves. So you have to develop a balance, okay? As I said, they're human beings, and it's very important to develop rapport with them. But it's not only about that. You can't succeed just by developing rapport and being a very friendly person. They're also operating on a mark scheme, and very similar to the MMI interview. They're looking at very specific points with regards to, will this person be a good medical student, be a good doctor in the future, right? So you have to make sure that you let those points shine through. Having said that, they are human beings, and as I said, there will be an element which will be dictated by personal judgments as well, and perceptions can be made very fast as well, particularly. So it's important, as I said, to strike a balance. So you're not overly thinking about, oh, I just need to impress these people in particular. Yeah, of course, you need to come across good, come across professional, well calculated as well, friendly. All of these things, building rapport is very important, right? And you have to have the appropriate balance between focusing on that and focusing on making sure that you demonstrate the appropriate attributes. So you don't want to lean towards only one or the other. You have to be balanced. So finally, in this type of interview, you'd be thanking them at the end of the interview. And this is your last chance to leave a really positive mark, positive impression, as they'll be finalizing the mark scheme as well at this particular point in time. And you really want to come across as humble and come across as grateful, all of the things which we've mentioned earlier, and just really re-emphasize the fact that you're really grateful. Something like, I'm really grateful for the time which you've given me today and for the opportunity. And I'd really look forward to becoming a valuable member of this university and of the NHS workforce, or of being a doctor within the workforce, Or I'd really appreciate the opportunity to become a doctor and impact people's lives, or, different things of this sort. So it's your really last chance to just thank them and leave off on a good note as well. So the format of the MMI interview will vary based on what university you're taking the interview in, but it can be a wide range of different question formats. Okay, so the first is the most simple, which can be a direct questioning format, whereby you read the question on the card and you have to perform a comprehensive, robust analysis of the question at hand. The second type can be a role play situation, and in the role play, you essentially have a paid actor who's there and they have their own particular brief, and you're going through a scenario. Okay, so now this scenario can test you in a wide range of areas. This can test you potentially. The station can be based on empathy. It can be based on you explaining a particular form of treatment to the patient, a particular procedure. It could be related to breaking bad news, whereby you really have to, make sure that the patient really understands what happened, and give them the appropriate warning shots, and make sure that you do it in a very, very emotionally intelligent way. You also may have some stations where you have to make professional judgment. Okay, so these are things related to your professionalism, professional integrity at work. There may be some complex situations, like how would you deal with a colleague who does XYZ. You may even have that colleague in front of you in the form of a paid actor in order to liaise with them on that. So with regards to the communication skills that you'll be required to demonstrate, okay, that's very, very important. And I know these are skills that, so especially in the role plays, these are excellent opportunities to demonstrate the fact that you have the key ingredients to be an excellent communicator, which is a vital part of being a doctor, right? So I know that this is something that you'll develop extensively over the course of your medical training and exactly with regards to the ins and outs, okay? But there's a general framework of what you need, and just try and always remember this framework, okay? So number one is comfort, okay? So These are strategies to develop effective communication. Yeah. Number 1, comfort. Number 2, acceptance. Number 3, responsiveness. And number 4, empathy. You need to make sure that you display all of these things when you're communicating with the actors in the role play situation, right? So, for example, comfort and acceptance, right? Comfort and acceptance. That's the ability to discuss difficult topics without displaying uneasiness, and the ability to accept the patient's attitudes without showing irritation or intolerance towards them. The next is responsiveness and empathy. That's the ability to react positively to indirect messages expressed by a patient. So essentially, all of these skills allow the doctor to understand the patient's point of view and also allow it to be incorporated into the treatment process that they're going to undertake afterwards. For example, it's very important in any role play situation that you react appropriately to the cues, okay? You display empathy, okay? If they tell you something sad, say, look, I'm really sorry to hear that. I know this may have caused you significant distress. I can tell that it's very distressing for you. I'm really sorry about this. I'll do what I can to help. I'm really here to help you. All of these things, right? You have to have and demonstrate that you genuinely care, okay? And you would have seen these things, throughout your work experience as well. And the fact that you want to be a doctor, it shows that you genuinely care as well, right? You genuinely care on the lives of others. So you really just have to demonstrate the fact that you care. The main thing is just to be always well-mannered, always speak well to the patients, and just try to be very diplomatic and understand, that they oftentimes, yes, it's about finding the solution. I understand it's about finding the solution. That's one aspect, but a lot of the times the solution is found in caring for the patient, caring for their needs, just showing that you're there for them, being that source of comfort. That's very, very important to take into account for all of these scenarios. The next one would be potentially a form of data interpretation. And the key for the data interpretation station would be mainly just showing you're working out and making sure that you can clearly, as we've discussed earlier as well, exemplify the fact that you have gone through this in a very logical way, coherent way. And it's not just about coming to the correct answer. In fact, it's not necessarily about that. But the main thing is to show your logical reasonings, okay? Show all your working out, your steps, and all the appropriate factors which you've considered in an appropriate way. And then you come to your conclusion, right? So just to give you a series of advice on how to conquer the MMI interview, okay? Starting off from the number 1, both the MMI and the traditional interview, they both cover the entire curriculum of what you're expected to be tested on, in order to prove that you have what it takes to succeed in medical school. So although they're different formats, I don't want you to get too bogged down into the specificities of each one. As I said before, yes, it's important to know it in the grand scheme of things, the concepts and how exactly it works, but we don't want to get too bogged down in it, because the reality is, as you've already internalized, is that you are the right candidate. You've taken out all of those kind of blocks of the mind, those imposter syndrome, and you don't have any confidence issues as well. You're humble at the same time, and you have the right way to answer questions, the right way to structure your questions. And all of these skills, they apply across the board, okay? And the key skills that they're looking at is they're all examined in each type of interview. So the next point is make sure that you have a structure to your answer, okay? So, for example, if you're being asked to weigh up the argument, you would have to have an appropriate structure for that question. So, for example, an introduction to the question matter at hand and the subject. You then have to develop a list of pros and a list of cons. So, for example, you'd be expected to understand the arguments for the particular question, and you'd be able to understand, you have to demonstrate your understanding for the arguments against the question matter, okay? And then you'd come up with a conclusion, finalizing all of your points together. Okay, so that follows a coherent and clear-cut subject matter. Similarly, when you're asked to develop an explanation for, let's say, personal skills, personal qualities, again, we'll go into this later on, but it has to have a structure to it as well. We tend to like to use the STAR structure in order to show all of the skills you have in the best possible way. Similarly, when you're discussing why you'd like to do medicine as well, you'd have in your mind, first of all, the fact that it's a very important question. And given the challenges that you have today in the current era with being a doctor, it's very important to have a realistic desire of this. I've tried my best to develop this by doing XYZ, for example, right? So you develop an analysis of the question, you understand it. You can even explain to the examiner the fact that you understand and you comprehended the question in your own words. It only goes to help and exemplify the fact that you have understood it and you're showing your form of reasoning. You're showing your logical wave of reasoning throughout the question, right? You then go on to discuss the pros of why you want to do your medicine. You can analyze, expand upon each one. You can also discuss the challenges of medicine, is the fact that demonstrates that your understanding is realistic in and of itself. Okay, so if you do get flustered in a particular station, the main thing that I would say is that don't let it get to you, don't let it ruin your entire station. This is very interesting because in this particular question or interview format, there's no one speaking on the other side. So you can literally take a pause, reshape, regather your composure, and the interviewer has the mark scheme, as long as you've done it in a graceful way and things like that. I mean, it should be fine. The main thing is to understand that this sometimes happens. And we don't want you to get too down about it and just say that. And then you start to blame yourself. Like a lot of interviewers, what they do is they say, "Oh, sorry, I said this wrong. I did that wrong." The main thing would just be, okay, just take a step back. Just say, "I'm just going to have a further think on the subject matter." And then you think, you gather your thoughts, you take your breaths, and then you can start again. Same way at the end of the station, if you've concluded in a good way and you're happy with your answer, and you've made sure to give a comprehensive analysis of all the points, then again, you can stop speaking in a graceful way, and everything looks good, everything looks comfortable, it looks confident as well. As I said, confidence can shape the mark scheme as well. In the MMI interview, if something really does throw you off though, let's say you feel, although you don't have any objective evidence for your perception there and then, if you feel that a particular station hasn't gone very well, then you do have the opportunity in between stations to reset. You do have some time. So just put that completely out of your mind and move on to the next one with a positive approach. And you have quite a few stations, so you do realize that one station which doesn't perhaps go in your way, hopefully it shouldn't have a huge weighting on the overall result. So it's really all about moving forward and that resilience, as I said, which is a key part of being a medic. Remember again that for the MMI, they're testing a general breadth of your knowledge and your ability to come to those answers, right? So if you don't have huge amount of knowledge on the particular subject matter in question, you can still work things out and demonstrate your working out, okay? You can still analyze and come up with various different points related to the subject matter. Again, it's very much about understanding that you have the ability to work these things out, rather than knowing a whole bunch of details about each and every topic which is there. The MMI interview tends to be a lot longer as well, so it's really important to stay hydrated and just to really mentally be ready for that. The fact that it's going to be longer, it's going to require a lot more stamina and patience in order to get through. Okay, so you have to really keep yourself going, really psych yourself up for that. Some do find that the traditional interview tends to be more intense because you're always in front of the examiner or of the person who's interviewing you, whereas in the MMI you do have those opportunities to reset. So it may be less intense, however it is longer, so it's more of a feat of endurance as well. So it's very, very important to look at the question carefully, okay, before you start answering, and to make sure you have a solid understanding of it before you answer. You may even wish to ask for a bit of clarification if they have the propensity to do so. Furthermore, it's very important to analyze the timings. You may have some stations in which they ask you 2 questions rather than 1, okay? Some stations you'll have to stay in the same booth for double stations. So you may actually have 16 minutes to answer the 2 questions, but instead you may answer both of them within the 8 minutes. If you're not sure of the actual timing format, it can be very dangerous for you. So you want to make sure you understand the format, the number of stations in each booth of the circuit, and you want to answer appropriately, okay? So make sure to take that time at the start. If you need more time before you start speaking, that's perfectly fine. Just make sure you do it in a very good and graceful way and a professional way as discussed. Okay, so this point is very important. In the MMI interview, it can be very tempting to be robotic. Okay, so you think that, for example, this interview format is very, very isolated. It seems like it's just you speaking. You don't really get that feedback from the other side. So people may not let their personality shine and personality come through. And this can be a big problem again. So it's not just about trying to memorize, as I said before, what was on the paper, but it's about working through it and making sure that you're as human as possible during the interview. So definitely let those skills shine through. A lot of the times in the traditional interview, on the panel interview, you actually have reinforcement from the interviewer, from the person who's interviewing you. You have reinforcement, the fact that they understand their point, they understand your point, they're agreeing with what you're saying, they're nodding, they may be making small gestures as well, maybe making small sounds as well. So all of that, it's very much different in an MMI interview, in the fact that it might just be you. So you may be tempted just to be robotic, just to be a bit less professional, a bit less on top of things. So it's really important to make sure to maintain that professional communication style, professional body language, and that formal presentation style at all times, and really make sure that you're showing the best range of your communication skills as well. Okay, so the MMI may seem closer to a formal exam than the interview. So again, with the traditional schooling system that we've done, and the fact that we have to sit a wide range of exams during our curriculum, we like to prepare answers, and we like to go through a lot of mark schemes beforehand, which of course it's good to develop those skills to answer questions. But in an interview setting, it's slightly different. Okay, so you need to make sure that you're able to work out things on the spot and not simply rote learning your answers. Again, you'll have to get used to the concept of giving longer answers for your question. So in a panel interview, you're unlikely to be giving very long analysis, very long explanation, detailed dive of all of the points, for example. Whereas in an MMI interview, you would have the opportunity to go into detail on each and every point. It can be more presentational, whereby you're going through points in a very systematic manner. So you'll have a lot more time to expand on your answer. So make sure you know all the intricacies of your application and all of the things which you've done to prepare and to become the best medical candidate possible. Make sure you have all of this information and that you can really draw upon it at any time in a very natural way. It's very important to get used to the interview format, okay? And we do a lot of mock interviews on this in StriveMed, so you can get in touch with us if you need further help and support. It's very important to get practice of the real thing, because it's very likely that it's not something that you've experienced before. Again, just one small detail is the fact that in this station, you have different examiners in each and every station, right? So again, it's just very good practice. Just thank the examiner at the end of each station when you're done. Okay, so well done for making it this far in the course. In this part of the curriculum, we're going to be discussing how to display an understanding of the challenges of medicine. And this is a very important factor, especially with regards to what I discussed earlier, emphasizing and explaining and getting across to the interviewer the fact that you have a realistic desire to pursue medicine. And this part, understanding the challenges of medicine, is very important, with particularly understanding a realistic picture of the situation, right? So you have to understand what exactly medicine is, okay, in order to understand this. So for example, let's say someone really wants to do medicine, right? Let's say you have two people, person A and person B. Person A really knows that he wants to pursue medicine, and so does person B. They know all the great things that can come with the career of working as a doctor. However, person A is much more aware of the challenges associated to become a doctor. Who's going to be the more ideal candidate for being a med student and a doctor in the future? Of course, it's going to be person A. The reasons are plenty, but just to think about the basic fact is the fact that if you understand the challenges from beforehand, you know what exactly it is that you're signing up to, right? That's very important. You know the challenges, you know what you're signing up to. You've already predetermined the fact that you will have to display resilience along the course of this journey. You've already agreed, you mentally have already agreed to go through all of the various challenges and the sacrifices that you've faced, right? So you really want to fit into the category of person A. And especially, I'll be honest with you, in the current climate, right? This is all the more important. I would say that potentially it's even more important to understand the challenges of a career as a doctor than it is to understand the reasons why you want to be a doctor. Of course, I wouldn't go so far as to say that, but I would say they're both extremely important. That's why I've put this section first, because in order to give a ruling on a matter, right, you have to understand the circumstance. You have to understand the reality of the affair which you're talking about, right? The more that one person understands what exactly a career in medicine is, the more he's going to be able to determine whether he wants to do that or not. And the more that he's accurately going to be able to determine whether he wants to do that or not. And the more he's going to be able to sustain the challenges that he's going to come across in the future as well. The first point that we need to understand when it comes to understanding the challenges of pursuing a career in medicine is sacrifice. Sacrifice is so important, and it's such a consistent theme in the life of a doctor. I cannot stress to you enough how much it's important to understand the sacrifices that you will have to face along the path of this journey of being a doctor. To exemplify this point, I would only like to take you back to your current journey, what you've experienced so far, all of the sacrifices that you've had to make in order to get the grades, in order to write your personal statement, all of the outings that you've had to decline, all of the time you've had to spend at your desk, the sacrifices that your parents have made, the financial input as well, the mental stress which you faced, all of this application. I just wanted to be honest and open with you and sincerely kind of project in the future and the fact that these challenges, they're not only in the application phase. The life of a doctor constantly involves handling stress, and that can often be the stress of the patient, because the reality is that the patients are going through a lot of stress at that time. They're in a difficult time. That's why they're coming to see you, right? Some of that will inevitably get transferred onto you. That's one example. There's so many other examples of stress in the workforce. In medical school, it's a long process. You have to study for long periods. You have to do a wide variety of endeavors. You have to do practical endeavors. You have to do communication, social-based skills. You have to do anatomy. You have to do sometimes dissection. All of these various things. You have to do book work. You have to do online. You have to do teamwork. And you may make more sacrifices than a student of another discipline, right? That's in medical school. I give you a basic example. The fact that you may have hospital placements, right? You may have hospital placements 9 to 5 throughout the week, and you're still expected to have not only retain the previous knowledge, but to add to that knowledge based on what you've learned in the hospitals, based on what your online curriculum demonstrates, based on what your in-person curriculum demonstrates. So you're technically going to be doing an intense physical endeavor going to the hospitals, right? You're also going to be doing an intense academic endeavor by studying alongside that, right? So right off the bat from your university, let's say your clinical years of medical school, you're going to the hospitals and you're studying in your own time. It can be very taxing. It can be very taxing, of course. Not only that, but as you become a doctor, there's various sacrifices that you make. You sacrifice, oftentimes, your sleep may be impacted. It may be impacted severely, especially due to the impacts of stress, which can impact sleep, over hyperarousal of the adrenaline system. This may happen, right? This may happen due to all of the stress that you're taking in. You have various things like night shifts. This can impact your health as well. The ability to maintain consistent diet routines, fitness routines can be very tough. The next thing it's important to understand that you may be sacrificing is financially. Reality is that a lot of other professions are out there that pay higher. Okay, that's very important to understand. And time is another thing which you may have to sacrifice. Well, you would have to sacrifice. Oftentimes the rotas, they're set in a certain way, so you'll be required to work certain hours during the week, right? This may not always align with your desires. It may not always align with your lifestyle, what exactly it is that you want. It may not always align with the exact ways you'd be wanting to spend time. It may not align with your family time, may not align with your personal life. But the reality is that we have a professional duty as doctors to make sure that we're adhering to the rota. Moving around, geographical flexibility, that's another very important factor for your training. In order to achieve your training and your specialty and your higher education as a doctor, you may have to move around to various locations. You may have to move around in order to go to med school. You may not always be able to be close by to your family. And this is a reality which many doctors face, many medical students face, right? Even gaining a position in medical school, it's a process whereby you're very blessed position to actually have a place in medical school. So you may have to go somewhere else in order to study. So this geographical sacrifice, it may actually occur during your journey as well. Holidays, again. So with a profession like medicine, it's very important to understand that you will have a fixed allowance of holidays, right? And oftentimes this can also be dependent on safe staffing numbers, right? So you will be heavily bound potentially by those staffing numbers. So even if you do have allowance for annual leave, there will have to be an appreciation of the fact that safe staffing numbers are always required at the hospitals. Otherwise, that can lead to detriment of patients and loss of lives as well. The next factor is that you have continuous exams and continuous learning, okay? And at this point, I wanted to lead you into a skill of answering this element of the interview. And I wouldn't say it's just an area of the interview which you're answering. This is an intrinsic value which you have, the ability to understand the challenges in medicine. It's going to come across, I believe, in every single question, every single element of the interview, whether it's an MMI or whether it's a panel. It's one of the key things, as I said, nowadays, right? So a skill of answering this to determine that you have a realistic desire to pursue medicine is to discuss the challenges and discuss them in if you want, in detail. If the format allows for that, you should be ready to present the details. I've discussed a lot of the details mentioned right now. Even with regards to those details, another point I'd like to mention is that we have so many podcasts on the StriveMed YouTube channel, which gives you such a realistic understanding of what it is, the life of a doctor, the challenges associated with it, the stresses associated with it. Just to give you a few examples, we've discussed, carrying a bleep. You may be having to deal with cardiac arrests and all of these different things. You may have to deal with difficult communications, angry patients, family discussions, work-based affairs, teamwork. Sometimes you may come across difficult colleagues, difficult things. In the workplace, it's honestly it's a lot, and it just keeps coming at you. So the StriveMed YouTube channel is a good place to understand a realistic understanding of that. So what I would do, bringing this back to the interview now, is to display your understanding of the challenges of working as a doctor. Then you can always spin them into a positive, right? So, for example, you've mentioned sacrifices, okay? You have to now spin this into a positive, which shows that you actually want to do this and you actually want to undertake those sacrifices. And you can say something basic, like, for example, this is a general wisdom, is the fact that there's going to be sacrifices in any field of life. No matter which field I pursue, there's going to be sacrifices. And I would really love to pursue a career in medicine and to sacrifice in these areas in order to pursue a field which I love, or in order to make an impact on the lives of many around the world. I understand that this is something I'd have to go through and something I'd love to go through, in fact. There is actually a sweetness in going through many of these challenges, especially if you look on the other side. You consider the lives that you're impacting, right? So I could go on and speak about this. I don't have to have a script. I don't have to have particular points I'm thinking. The reality is I've been a doctor, right, for multiple years now. And I can just reiterate to you, because I have a realistic understanding of what it exactly entails. I understand that, yes, there's challenges, but these challenges are worth it in the end, okay, as per my opinion. That's obviously why I'm applying here, why I'm here in the first place. I'm applying to medical school, right? So that's what you really need to get across, okay? So, for example, sacrifices, yes, but it's worth it. And then you can bring another pro in the question, right? So this is how you have to balance it, right? It's a seesaw. It's a constant seesaw, right? The thing goes down on one side, it goes up on the other side, right? And then you constantly have that flux and you're analyzing. And in the end, it's all worth it for you in the future, right? The next one is straightforward. You have continuous exams. Now, this can be very difficult, can be very taxing. Now, you have to have a lot of, again, sacrifice for this. You have to study, you have to put financial input, you're constantly doing exams. Even when you're working as a doctor, you have portfolios to complete. These are all mini examinations. When you're on the ward, you're being examined by your seniors as well to make sure that you're doing the optimal safe practice, etc. Your colleagues and like all of these things, the colleagues will be asked to give feedback as well on your performance. So not only that, but in order to advance your knowledge, there will be certain exams which you have to do. And you may think that, oh, all of my studying and my hard work, let's say you're someone who doesn't love studying that much. Yeah, you may think that, okay, it will be done in med school, let me just graft it out. But the reality is that you'll still have to do exams later on. You'll have to top up your knowledge. You'll have to maintain your knowledge. This can be a very big con for some people, right? It can be very tedious for them. But now you flip that into a pro. What's the pro of doing exams for so many years in your life? What's the pro? The pro is constant learning, continuous development, self-development, self-evaluation, becoming better as a person, a more knowledgeable practitioner, right? Even just the other day, you come across surgeons who are practicing all the way into their 50s, 60s, refining their skills, becoming better at their craft. You learn a new thing in every operation. Not only that, but practice is evolving, practice is improving all the time. You have various different treatment modalities, whether you're discussing surgical endeavors, whether you're discussing medical practice, it's always improving and advancing and adapting from one stage to the next. So upon you is to have that constant learning. And so again, that's actually a very good thing about the profession, is the fact that you're doing constant learning and you're keeping your brain sharp throughout all of your career. The next point, again, it's a very big challenge as well, is that you're going to have potentially sometimes very long work hours. Okay, of course this is flexible. Okay, there are some, and it's quite increasing nowadays as well, you know, less than full-time flexible training, and there's quite a good allowances as well, you know, things like they are understanding, you know, if things do happen, maternity leave, paternity leave, all of these laws are in place as well. You have, you know, if someone's unwell, then obviously there is the appropriate protocol for that. But reality is that the conventional working pattern, it does involve long hours, right? And most of the people, they do the conventional working pattern. Obviously, that's why it's called that. But the main thing is to understand, like, for example, a normal working day, maybe let's say 9 to 5, 8 to 5, 8 to 4, like let's say around the 8 to 9 hours mark. There may be times when you're on duty for around 12 and a half hours, right? So you just think about it logically, how much time is there to do other things during the day, right? So again, it's a sacrifice. Medicine is taking a large proportion of your day, sometimes more than half of your day, right? And then you have to go home and sleep, of course, you have to eat, you have to do the basic essentials, of course, to stay alive, right? During that shift as well, the on-call shifts, that's when you're expected to cover sometimes like out of hours as well, right? So when there's a reduced staff and you're essentially dealing with emergencies, dealing with acute presentations there and then before their regular day teams or their regular teams see them, okay, the following day after your shift is done. Or if you're handing over into the twilight shift, which is the evening shift, then you're handing it over to the night on call, okay? So there's two types of on call. One is day on call, one is night on call. You can have on calls on the weekends as well, which is when the regular teams, they, you know, some wards or some specialties, they may not have a dedicated ward round on the weekends. Some do, of course, but the on call team will be regularly dealing with especially those wards for acute presentations, emergency presentations, which are they don't have their regular ward team dealing with them or serving them during the weekends as well. So you have the weekends, you have the evenings, okay, for the working days, and then you have the nights as well. So you may be handing on to the night on call team, which is why you have to stay till a certain time and you hand over to them, and then your shift is finished officially, okay? So it's very important to understand that these on-call shifts as well can be very stressful. Again, it's in our podcast and we discuss about them. For example, you're dealing with a bleep. The bleep is something that stimulates your adrenaline response. It's very stressful. As soon as the bleep comes, you realize that this could mean anything. Someone could technically be dying, right? So you may just be having your lunch and someone's, okay, the bleep comes, and then that's it. You suddenly spark up. You're trying to go to the appropriate ward where they tell you to come, and you're dealing with a patient who doesn't have a pulse, let's say, not breathing, or their oxygen is deteriorating, their blood pressure is dropping at a rapid rate, and you have to find out why. Can you just imagine how stressful that may be? And you may be doing this right until the end of your shift, and then you go home and you're sleeping, and you're doing the same thing the next day. So again, I've been doing this at the workplace for a long period of time now. I can truly speak about it, but I'm trying to explain this to you in order to understand truly what it is. The more you understand the various challenges that there are, the better you'll be at explaining a realistic understanding, okay? So again, you can flip this into a positive as well. The work hours, you know, you really like to focus, you like to dedicate yourself to a particular task, to a particular mission and a vision in life, and you'd be happy to spend a lot of your times in the hospital. This is an experience you have, this is a location you have a lot of experience in. Yeah, you've done work experience. Let's say perhaps you've done work experience, you've followed the rota of a junior doctor. Yeah, you've stayed in the hospital the time that they've stayed in the hospital. You've done on calls, all of these things. Not that you've done on calls, I mean you've shadowed on calls, of course, but you've been in the hospital the same length of time. That's very good. You know, that's very good. You have a good understanding. Let's say you've done something else in your work experience which shows you the challenges of medicine as well. It's very important. It's a very good opportunity to bring that through, especially in the traditional interview where you have one thing that gives. So there's a popular saying is that one question gives birth to the next, right? So you may be answering a question about challenges, and then you may start to speak about that. Especially depending on the speed of the interviewer, they may say, let's say you're speaking about challenges and you bring up work experience. So from my work experience, I saw the challenges related to this. So for example, intensive care unit, the patients, the families may have a lot of distress, all of these things, it may be related to that. And then the questioner may ask, oh, tell me more about your work experience, right? So you have to be dynamic, willing to adapt to these, because one question may give birth to the next, okay? So just to summarize that aspect is that, again, you can make the work hours into a positive if it's something that you like doing as well, yeah? Again, it's much easier to spend long hours in something that you like doing, and if you know that you genuinely like this, you genuinely appreciate all of the pros, which we're going to discuss in the next section, then definitely working long, who minds at the end of the day, right? If you're doing something you genuinely love, right? The main thing is that you're going to have to work hard in any profession, yeah? You may have to do business that takes a long hours, especially at the start, to set up, right? You may be doing other professions, accountancy, for example. You may have to spend long times in the hospital, in your office as well for that, right? So that's basically how you kind of harmonize between the challenges and the benefits of being a doctor as well. And I wouldn't say directly, I wouldn't use the terms, again, this is some mindset, very important mindset shift to use. I wouldn't get used to saying pros and cons of being a doctor, right? I would just say pros and challenges, because challenges is something that can be overcome in order to make it a pro. It's just something that you have to face, right? It's just something you have to face. It's not like necessarily, I wouldn't frame it that much as a disadvantage, because there are ways you can do about it. There are things that you can do to combat it, to improve it, improve the situation, and to really not make you feel those challenges that much. Again, the idea of the starting salary. Now, I know there's been a lot of talk about this in the news recently, and this is something that you can, adequate research you can do online. It's there. We have a podcast about this as well. But the main thing which it's important to understand is that, and you can even get this across in the interview, is that yes, doctors, they tend to be, especially as you progress, right? In the start, the salary may not be so much, but the progression is there. You have that financial security, a bit more like job security than many other fields out there, right? So again, you can use this challenge for salary, but you can counter it and you can say that, yes, I understand that the salary isn't necessarily high, but I understand that I'm doing this as, a vocation which I love to do, and to be able to have the opportunity to be paid for helping others is something amazing, right? So you can put across things in that aspect. And the fact is that you can still have a relatively comfortable family life. Yeah. And there are also avenues to, which are higher paid than others, which you can explore as well. So it's not all doom and gloom in that aspect. And the reality is that, again, you focus on turning this into a positive, right? So that's very important. And in reality is that there are many positives associated, even when it comes to the financial elements. There are good options for this. Okay, again, you only need to do a bit of research for that, and you'll see the outcomes of that. Okay, so this is a key aspect of the medical interview, is demonstrating your motivation for medicine. We've touched upon this countless times throughout the course thus far, is the realistic desire. So we've already touched upon the realistic understanding of the challenges, and now we're going to touch upon the motivational aspects of your desire for medicine and why you actually have that desire in the first place, and convincing the interviewer or your examiner of this actual aspect. Okay, so the actual core of being a doctor, this is the actual core. Okay, I could, even if I don't expand on the rest of the points, I'm happy to just leave it at this, is the very core is helping your fellow human beings. It's the human aspect of helping others in their time of need. This is something which is very important to exemplify. Yes, you may enjoy being in a hospital, you may like using your brain, you may like using your communication skills, all of these skills to answer. There are a lot of factors. Okay, I'm not going to tell you that there aren't many other factors why you may want to be a doctor, but you have to get this across, is the very human element of being a doctor, is that you're doing an act of service, an act of caring, an act of empathizing, an act of removing or aiding the suffering of your fellow human beings. And that's something very noble, a very honorable endeavor to spend your time with as a human being in this limited time that we have in this life. Very important to remember that being a doctor is one of the highest form of human care and care which you can give to others. It's a very virtuous position to be in, and it just really can't be understated. So you have to internalize this, okay? And that's going to be done over a series of different things. But as I said, the key recipe is introspection and having physical experiences. You have a combination of both that leads to reflection, internalization, and then that will come out naturally. Okay, just how I was speaking about it in the last minute or so. I've really seen a whole range of experiences in the hospital. People suffering, families worried about their loved ones. And you are there in their time of need, trying to aid them. You have knowledge which they don't have. Let me sink that in again. You have knowledge of medicine and how to aid them and how to take the means to aid them, which they don't have. They want you to help them. They've come for you to help. That's absolutely astounding. If you just think about the position of doctors, right? You really have to express that first and foremost. As I said, even if we leave the rest of the points, just please make sure that you focus on that. As an extension of that point, which is helping others, right? You need to make sure you specify very clearly why it is that you want to help others in a medical parameter, in the parameter of being a doctor. Because the reality is that many professions, I would potentially even say most professions, I mean the whole concept of economics, right? Supply and demand, right? You're meeting the demand of others by supplying something that someone needs. That's how you get a monetary remuneration, you get monetary compensation, right? Someone needs, you're helping them with a product, you're helping them with a service, yeah? You can be a personal trainer and help people improve their health, yeah? You can be, as I said, there's so many. You can even be someone who's offering combs to people, selling combs, yeah, a beard comb or anything. You can be offering products. You can be someone who's serving food. These are all ways to help people, right? We understand that it's very important to help our fellow human beings and to use our time and effort in this noble cause, right? But now we need to specify why it is that we want to do it in a medical parameter. Okay, so there's two main areas, there's two main ways of doing that. I would say, actually there's way more, but I would focus on the main ones. Is that first and foremost, you may have had an experience where you've seen the direct impact. Okay, so for example, you just kind of project this in your own brain. Let's say you're serving food to someone, okay? For some people, serving food and serving great food, that genuinely is a more rewarding way and a more fulfilling way to them of aiding the fellow human being, right? They're making a lovely meal. That meal is filled with love, care, attention, empathy, appreciation. You give that meal to someone you love and they're enjoying it, right? That's an aspect of care, and that's some way in which you're helping people. They really feel as though it's, and oftentimes it is. When's the last time, just think back, when's the last time you've been on the receiving end of a glorious meal someone that you love has prepared for you? It's quite an undescribable feeling. So the reality is that you can project yourself into all these different areas of helping a human being. Do you fall in that category where you prefer to give people food? Or do you prefer to help people at their time of need in medicine, right? So in medicine, you'd have to have a realistic projection of helping people, right? That realistic projection can come through doing your work experience. You've seen maybe previously someone in your family, not everyone has family experiences, but in your work experience, you should see plenty of this, is that the reality of positive health outcomes, Sometimes there can be negative health outcomes, but you've been there for someone to help them, to try and digest what exactly has happened, to try and recover from that, and to give them the news in a more palatable way. Yeah, that again, in and of itself, is a huge form of care and service to the person. Again, you may have seen an operation which touched you, a surgical operation whereby a patient is able to walk, able to utilize their limb, able to live without pain, able to live without that suffering which had plagued them for so many years of their life. You may have had experience of aiding someone in an emotional perspective, a psychological perspective. So there is sweetness to helping people in all of these variety of ways. Yeah, even helping people with their cars. You have different professions, and they all help people in a different way. So you really have to qualify how it is that your love for helping people is in a medical parameter. So as I've already said, you can have seen experiences of helping people. You could have experiences of helping people. Like, let's say you've helped people before, yeah. That in and of itself does not necessarily fulfill your desire for medicine, because as I said, you can help people, yeah. So for example, you ran a charity, for example, yeah. You could then go on to be a philanthropist, for example, right? Now, that doesn't necessarily have to involve your understanding of medicine, right? You can be working on food donations. You can technically be a businessman in order to do that, in order to gain the money to do that, right? Again, it's different if you want to be a philanthropist from the medical perspective. That's, again, it's all about introspection. What is it that you genuinely want to do? Is that ingrained deep enough in your heart such that it will come out within the interview? So if you've just said, yeah, I've helped people, that's why I want to do medicine, there's still a big missing link. So that link can be bridged from the experiences you've had, your accurate projection, as I've said, and the next point, okay, would be all of the various aspects of life as a doctor, okay? One of the key ones is using your physiological knowledge in order to help people, right? So as a foodie, let's say as a chef, yeah, you may be able to help people, right? But what knowledge would you be using? What skills would you be using? Are those the skills which you want to use in your workplace? Are those the skills which are most catered for you as a person? Are those the skills which you even have in the first place, right? For example, in school, you may have loved biology, you may have loved the practical application of the sciences, and you could think that there's no greater honor and no greater way to spend your time on this earth is using that knowledge of physiology, that gift which you've been given, which you obviously want to expand upon in medical school in order to aid the suffering of your fellow humans, right? So you really feel a great sense of fulfillment in using that knowledge. The next one will be touching upon the various skills. Okay, so obviously I've discussed already the utilization of your physiological knowledge of biology and applying that to real life. The next one would be the skills, the human elements, yeah? Empathy, teamwork, leadership, communication, responsibility, reliability, empathy, all these personal skills, yeah? All of these are used to a great extent in the medical field. And again, you can make the argument that they're used in other fields as well, but you really want to use it in a medical parameter as well. Okay, so you feel that you'd be really suited to use all of these skills in the medical field, as it would be a very fulfilling way of using your time as well. And also you'd have the prerequisite skills required to succeed in it. The next point is to realize that it's a key point of the human's life in which they're asking you to help them, right? So it's a big responsibility. This may be different. Again, I'm going to go back to my food example, right? It's not necessarily a situation of life or death. If the person misses the meal, right, they're most likely to survive for longer. And obviously, of course, you have to make sure not to poison the food and things like that. But in a medical parameter, some may say that it's more directly related to life or death. And not just that, it doesn't have to be life or death, but the reality is that people are very vulnerable. They're at a very scared position of their life. They don't know what the future holds for them, and they're coming to you in their time of need. So it's really just internalizing that and just realizing the virtue that comes with, in order to be a responsible practitioner for someone who has come to you at this major point of their life, whereby you can be someone who who helps them, who's a means for them, their lives to turn around for the better. Again, these are various pros, again, which come with the medical profession. The first one of them is that it's a very global profession. Okay, so you can use your medical skills all around the world. Okay, this is something that is recognized all around the world, something that's needed all around the world. Okay, as I mentioned, the previous geographical, you may have some inflexibility, especially while you're training potentially. Now, later on, that tends to become the opposite. It can become the opposite, especially if you play your cards in the right way, whereby your skills will be appreciated all around the world. And so you can really use that to move to a wide range of destinations of your choice. You have good job security, okay? The reality of human beings is that they have a certain lifespan. They go through ailments in their life, yeah? The longevity is limited, right? So there's always going to be a demand for someone to help someone else in their time of need from a health perspective. Okay, that's very important to realize, and it aids with financial security, family stability, and these kind of factors. The next point is variety, and it's just profound. Honestly, you may be on a surgical job, you may see someone with a bowel perforation, bowel obstruction, yeah. Let's say that they have a problem with their intestines, their digestive tract. Next thing you know, one of your next patients may be someone who has had their leg amputated because of lack of blood supply. Yeah, you may come across a patient who may well be a surgical patient but has cardiovascular comorbidities as well, and now you had to treat their atrial fibrillation, which is an abnormal heart rhythm, right? So the variety is so much. Each and every patient that you have, there can be so much interplay between all the factors of their body, all the bodily systems and their intercommunications, and it's just vast. And you really, really need to be a good problem solver. And a lot of the people, they love this variety in their work as well, and that's why they want to excel and pursue the career of being a doctor. The challenge, as I said, some people, all of those challenges you mentioned, some people genuinely love that. They don't want a monotonous work lifestyle where they're doing the same thing. But to be honest, even if you wanted to do the same thing every day in medicine, there's aspects where you can get a role whereby you're doing the same thing every day. So, or quite similar things every day, some stability, consistency. So the reality is that medicine caters for people in all walks of life, all ethnicities, all personality types as well. And as I've said this before, so for example, I deliver a lot of presentations on this topic, and you could potentially be a doctor in so many different settings. You could be a doctor in space. You could be a doctor in the football pitch. Yeah. The reality is that everywhere where humans are, doctors are needed, right? Of course, their services would be needed. You can be, as we said, you can be on boats with regards to charitable projects, helping people in different countries, MSF, Doctors Without Borders, right? You can be doing all these various different things. You can do tropical medicine, you can do a GP, you can do A&E, you can be a surgeon, you can be in the helicopters of all these hospitals, being the first responders on the scene. So the reality is that the opportunities in medicine are vast, and as well as, for example, personality type matching is very important as well. So you could be someone who's quieter, who doesn't prefer that much patient facing things, but you still want to use your medical knowledge, right? You may consider something like radiology, where you're looking at scans and you're still using your brains and having an amazing impact on the patient outcome, but it's just in a different setting, right? If you really want to be in primary care, for example, in a GP, you're doing consultations, you're seeing a new patient every 10 minutes, new problems, new intricacies, you don't know where it's going to take you. You may consider GP, you may consider A&E as well. New patients all the time, different challenges, a lot of adrenaline, a lot of high pressure. So again, medicine can be for everyone, okay? And these are all the important factors that it's very important to consider before getting into it. And it can be an amazing profession, especially if you do things in the right way. Another point to consider is the satisfaction which you can get from doing a job which truly fulfills you. Again, it's very satisfying, and it's very, like, as I said, I've already touched upon this, but being there for people in their time of need, helping people, again, that's something which is a very satisfying, and it's a very noble thing to do. Okay, so in the next section of the interview course, we're going to be going over the knowledge elements that you need to know in order to succeed, okay? So the first and foremost part which I want to discuss is the ethical scenarios, okay? And it's very important to have a good understanding of medical ethics. The reason is because it applies into all different areas, right? So all different things, subject matters that you're required to know or have some general awareness of, yeah, you may be asked to apply the medical ethics to them, yeah. You'd be expected to apply these medical ethics in situations which you may not have even heard of before. So the idea isn't necessarily to try to have all the knowledge of all the current events which are taking place, right? In reality is that you won't have all the in-depth knowledge of all the current events that are taking place, but the main idea is to have a general understanding of what's going on in the current climate, and then you'll be asked to apply the medical ethics, okay, the various the 4 medical ethical frameworks, okay, and apply them to all the different scenarios. The reality is that the 4 pillars of medical ethics can be applied to almost anything that you do in the life of a doctor. So you should be able to think about, okay, is this impacting patient autonomy? Is this action good for the patient? Is this action something that the patient wants? Is it just? All of these things, you can technically think about that in every single situation that you're in, right? and the reasons with regards to why you're doing them and everything. So it's a very important practice to just get into the habit of get used to applying this in all different areas of your practice, all different articles which you read. What they're looking for is application of this. Again, as I said, not rote learning it, not kind of giving them a list of points, because what happens when you're faced with a new scenario which you haven't revised? Yeah. In the real workforce, you're going to be faced with a list of scenarios. You're going to be expected to act according to these medical ethics. If the interviewer sees someone who's trying to revise the script in his head only, and he comes across as robotic, and he's not really coherent, not really making sense from a real life perspective, then it's not as good as someone who is able to take the information, amalgamate it, and give a logical, fair understanding and arguments on both sides, and understanding the nuances of various different factors in the particular case at hand. So what are these 4 pillars of medical ethics? Okay, so we'll start off with a quick summary explanation. So autonomy is respect for the patient's right for self-determination. Beneficence is the duty that we have as doctors to do good for the patient. Okay, non-maleficence, okay, these two go hand in hand. There's a few differences between them, but it's the duty not to do bad to the patient. And the 4th one is just justice, is to treat patients in an equitable manner, and we'll expand upon all of these pillars. Okay, so the main concepts which you need to understand when it comes to autonomy, the first pillar of medical ethics, right? The ability to self-legislate, to make decisions about your own healthcare. So just to take us back in history, how the model of healthcare used to be in the past, it used to be a paternalistic approach. Okay, so paternalism, medical paternalism as a definition. Okay, so that's when a physician or other healthcare professional makes decisions for a patient without the explicit consent of the patient. Okay, and this will involve various other factors. We'll go into consent in a bit more detail as well, but it would likely entail the fact that the patient doesn't have much information of what exactly is going on with their health, what exactly is the problem, what exactly is the treatment, and how they're going about the certain things. So it would mainly be like the patient essentially does what the doctor says, in simple terms, right? Another definition which is quite helpful is it's a set of attitudes and practices in medicine in which a physician determines that a patient's wishes or choices should not be honored. So medical paternalism used to be the prominent strategy or the prominent protocol for centuries. But in the current times, it's shifted away from paternalism into a joint approach. So the joint approach is something called shared decision making. Okay, this is something that's very interesting. It's not gone to the other extreme of, for example, patients saying exactly what they want. Okay, so the doctor's expertise and knowledge of the situation obviously does have an important role to play in the situation, right? It's not that the patient has autonomy, the ability to make choices. They just come and they just say what they want and they get it. It doesn't work like that. So it's gone to kind of a middle path whereby essentially, yeah, doctors cannot force the patients to follow their advice, but equally, doctors can refuse to give treatment that they think is not in the patient's best interest, okay? So it's kind of the middle path, and that's the prominent healthcare protocol which is being followed nowadays. And it's very important for us to be able to understand this, right, in a wide range of contexts within the medical climate, right? You have something in medicine which is called the patient agenda and the doctor's agenda as well. And you may have a patient coming in, he wants a certain thing, she wants a certain thing, they only are after that, but it may not be in their best interest, right? So you analyze these various factors. You may say that yes, the patient may have autonomy, yeah, with regards to a very important pillar of the medical ethical framework is that they have the ability to make decisions and make choices about their healthcare. However, this may compromise the other principle, which would be primary in the situation, which is non-maleficence, yeah, which is the duty that doctors have to do no harm. All right. So if the particular medicine or what they're after would be more harmful for them, the doctor doesn't have to necessarily give that treatment. So again, that was just freestyle from the top of my head with regards to the particular situation. Like, let's say patient comes to your room, they want this, it's not good for them, etc. Right? I'm just trying to get you into the framework of thinking and applying these principles to anything. Okay. so many situations may arise at work. Let's say, for example, you're going to take a history from a patient. Yeah, have they consented for the information to be shared with you? Have they, like, your mind can be, I really want you to be active about this. I really want you to think carefully about this, and the fact that, have they consented to the treatment which they've had? Do they have the accurate information in order to uh, to weigh up the pros and cons and to weigh up the potential side effects? Have they had the appropriate consent procedure, which is the information provision, let's say, for a surgical procedure or something like this? Yeah. So, as I said, any situation which is there on the ward, it's important for us to be able to apply all of these principles. Okay, so in order to satisfy the factor of autonomy, yeah, it's important and it's required to have the voluntary, well-informed understanding consent of the human subject in a full legal capacity. Okay, so voluntary, well-informed understanding, and then we have consent. Okay, these are very important factors of consent. Let's say if there's a language barrier, does the patient have true consent? Does the patient have a true understanding? Yeah, he may, let's say he says, I want a treatment. Does he have a full understanding of what he's signed up for? Yeah, he may not have a full understanding of what he stands for. So that could impact the consent process in a negative way. As I said, well-informed understanding. Okay, so you need to be able to retain the side effects, potential complications. You need to weigh up the benefits, potential harms of a procedure. All of these things in a joint decision-making process, the patient needs to know these things as well. It's not a situation where the patient takes orders. Okay, you do this to improve your health. Okay, yeah, that's exactly what I'll do. You have to take as well the patient's wishes into consideration. If you just think about this from a wider health perspective, right? So again, you can apply this to all the recent things. So the recent topics which surely you'll have to read about, COVID, for example, yeah? There's various discussions people will have with regards to the lockdown structure. Does this impact the autonomy of the people who are locked down, essentially, right? People who have, again, so now there's lockdown, you might have impact on people's autonomy, but then again, there's also public health understanding of potential for spread of the virus, right? So again, in this situation, one may say that it's important to do no harm as well. And then if the lockdown is not actually carried out, wider harm may occur for society. So these are all the factors which are considered. So as I said, any news, any current event for the NHS, for the healthcare system, any healthcare system, whether it's this one, whether it's abroad, anywhere, right? You can really apply these principles to a great level. Another very important aspect for sufficient autonomy to be fulfilled is that the patient should not have any undue influence on their decision-making process. Okay, a patient's decision must be free of manipulation, coercion, and deceit. So as practitioners, we have to be truthful and give the full scope of the information as appropriate to the patient that is their understanding. We must make sure that there's no outstanding external factors influencing, coercing their decision into a decision that they don't want to take as well. So in order to give consent and to weigh up so for autonomy, okay, and for the appropriate consent process, the patient needs to have capacity, okay, in order to make that decision there and then on the spot, unless there is some previous documentation which illustrates that they have already made the decision if they were to reach a particular health outcome, okay, or a particular health situation, right? We know the aspect of DNAR. This is something that's like a do not attempt resuscitation form. And this can be signed like if something were to occur, like cardiac arrest or, sudden deterioration, then essentially it's the pre-signing of a form, yeah, when the patient is well, is that if this deterioration were to occur, yeah, and for the heart to stop beating, then essentially you would not wish to do resuscitation attempts, right? The conventional resuscitation attempts, this involves something that can be very stressful as well, the CPR process, etc. So the patient doesn't wish to go through all of that, yeah? So all of these things that can be documented beforehand, because of course the patient at that point in time is not in a position to make those decisions, right? So when the patient is well, that's when the patient makes that decision. It's well documented, it's well signed, it's in the patient's notes, okay? For capacity, for a patient to have capacity, it's important to have these 4 things. One is to understand the information which is provided, right? And this is a comprehensive provision of the information. It includes possible side effects, possible pros and cons of taking the therapy, taking the procedure. Okay, so it's not just a one-sided thing. It's not. It's a fully informed procedure, as I've mentioned before. Fully informed process, right? The next is to retain. Okay, so you need to have adequate mental faculties to retain and to demonstrate that you've retained it. Once you've retained that information, you have to be able to weigh up, as I said, like interventions, they do have, there are risks associated with them, so you have to be able to weigh them up, right? There's always something that can go wrong, so you need to be able to weigh up, okay, what may happen and make that choice appropriately, and demonstrate as well that this is you do have those factors in place in order to weigh up and make the choice appropriately. And then the next one is to communicate your decision as well, just so that it's clear, there's no confusion with regards to the decision that you've reached, and that would necessitate capacity, right? Patient can then consent for various health outcomes, various health procedures, therapies, etc. through this process. Okay, so it's very important to understand that these 2 concepts of capacity and consent are very closely related to the first principle of medical ethics, which is patient autonomy, right? So I've already discussed the concept of DNAR. Yeah, that was one topic which I just freestyled in my head. There's so many different things within the healthcare which could potentially impact the capacity. I've already discussed. Will consent be valid? Yeah, if the patient cannot understand, if they're not speaking the same language, yeah, if they haven't really understood, is that consent valid? All of these things, you can really start to apply them as you go about, and as you go around in your work experience, you read up various cases. So the next pillar of medical ethics is called non-maleficence, okay? And this is the principle of doing no harm to patients, right? This can be either intentional or unintentional. So there's 2 aspects of this. So the first one would be intentionally increasing the risks of harm. So for example, let's say a patient has a wound and the doctor or the nurse decides not to put on the dressing, even though if it's not dressed, if it's left open, it would increase the chances of infection. That would be intentional harm, right? The second would be unintentional. So prescribing error would be an example of that. Let's say if a doctor gives the wrong dose for a patient, that would essentially cause harm to the patient. Now, the harms can also be of 2 aspects, okay? And when you're analyzing your cases, you can differentiate them into physical harms and emotional harms as well. The principle of non-maleficence is very closely related to beneficence, which is the duty to do good, okay? So actively going out and doing good, and also abstaining from doing wrong as well. So for example, I give you a scenario, like let's say you see someone who is at the edge of a cliff, or let's say he's at the edge of a pond, yeah, and he knows that the other individual can't swim. So he's walking by and the person falls into the pond. He knows he can't swim, but he just walks by, right? So he actually has a duty, just, as a civilian, it's important, like if he can, try to help the person who's fallen in, right? So the fact that if he just walks by and he doesn't help him, that would be going against beneficence, which is to do good, right? To do good to others. He hasn't actively done harm because he's not the one who made him fall in the first place. However, it's still not the correct action to do, especially if it wouldn't have put him in danger to help that person who's fallen in and they can't swim. Similarly, a patient comes to A&E, they have a heart attack. It's important to actually treat the patient for that heart attack. Yeah, you can't just let them be and do nothing, right? So again, that is the importance of beneficence, right? The aspect of non-maleficence is not to do harm to the patient. So for example, in regards to non-maleficence, right? When you're walking past someone in that situation, yeah, it would be in the situation of someone who's standing by the edge of a pool. You well know that he can't swim and you actively push him in. So that's actively doing harm, right? Again, that's another awful action, but the reality is that the nature of it is slightly different, and both of non-maleficence and beneficence must be ensured in medical practice. So for example, let's say if a surgeon is performing an operation, right, and he's meant to take out an organ, let's say a kidney, right, nephrectomy, and he does harm to the patient by, instead of taking out the kidney that you should have taken out that was impacted by disease, he takes out the healthy kidney, and he's performed harm to the patient, right? So either intentionally or unintentionally. So all of these must be avoided. So justice is the fourth pillar of medical ethics, and the official definition is fair, equitable, and appropriate distribution of benefits and norms. Okay, so the reality of the situation in life is that healthcare resources may be limited, right? And it's important for public health professionals and healthcare professionals to distribute them in the most just way. And in UK, again, there's a lot of different factors to consider. In the UK and around the world, there may be socio-economic disparities, geographic discrepancies as well. But it's very important that we allocate resources and healthcare in the most just way possible. So, for example, obvious elements of the justice factor is to make sure that discrimination is not occurred on geographical location, color, race, religion, things like this, right? For example, if this, the cases where it can become a bit complex is related to risk factors and things like this. So, for example, does it become discrimination if, let's say, a practitioner refuses to perform cardiac surgery on a patient because they smoke? Would that be discrimination, or punishing the patient for not stopping his smoking? Or would it be a fair medical judgment with regards to potentials for increased complications for patients who smoke after cardiac surgery? Again, so one area you could apply it to, quite prevalent in the current time, is the public health aspect of obesity. There's many different things. So, for example, there's sugar taxes which have been proposed. Is this something which is just? Is it good? There may be different aspects, different access to healthcare based on health conditions. Are they just? Are they correct? Let's say if someone was asked to carry out a lockdown in one area but not the other area, is it just or is it justified? Yeah. So all of these different things, again, as I said, you can apply it to every case. You can really delve into it. And the main thing would be to practice. If you want someone to do it in a supervised manner and professional or trained doctor, then you'd be able to essentially make it second nature. That's the main thing. So you go through any medical case and you say, right, this case, and then you list the four medical principles of medical ethics, and you're able to analyze, okay, this aspect relates to this aspect relates to that. It's really about just becoming fast and applying that to any situation that you come across, right? So we have those services on strivemed.co.uk. You're more than welcome to liaise with us for interview coaching as well. Some of the hot topics and the key topics which we've outlined, we've seen, is that basic knowledge about the NHS, what it stands for, the background, the constitution, Health and Social Care Act would be important to have a brief understanding of as well. Recent topics, the junior doctor's contract, the idea of potential of A&E waiting times, the various pressures, the various steps which the government are taking to try to enhance the NHS, and all of these different things. Of course, COVID was very huge, and that's potentially very likely to come in the interviews, as that was a huge public health endeavor from all aspects, and it included a wide range of disciplines and specialties from a political perspective and a healthcare perspective as well. So the next step would be to make concise notes of the explanations of the principles of medical ethics, right? The four pillars, and then just read as much as you can. Read as much as you can about healthcare, the current climate. Try to apply it as much as you can. Read as many cases as you can, and really just apply it. Look more into consent and capacity as well. These are very important, and the various complexities and the nuanced approach, how in some cases consent may be actually valid, in some cases it may not be valid. So these are all very important nuances to have a great understanding of before the interview. Okay, so the next chapter is all about personality-based skills. And this really covers you as a person and the skills which you have, those which you've developed throughout your educational career. It may not be simply academic, right? And this is where it's important to consider, is that a lot of the people who would be getting interviews, successful in getting invited for the interview, a lot of the people who want to do medicine, they do this because they're good at academics, they have an academic background, they want to, as I said, use their physiology to help different human beings, right? But there's personal skills which we have intrinsic, innate, which we're born with, and we develop them through experiences which we have. Not only do we develop them through the experiences which we have, but we demonstrate them. So it's important to be able to demonstrate these skills to the interviewers. These skills are essential throughout medicine, of course, and you'll use them in various different capacities. Yeah. So, for example, various skills and qualities which you have, some of which would be inspiration and emotion, your leadership skills. There's so many different cases in medicine where you have to be a leader, especially as you rise through the ranks. But even as a medical student, you have to display leadership skills in various different areas, various processes. You have group work, you may have to be a leader in that. But even as a junior doctor, you're teaching medical students, and always as you rise the ranks, there's always going to be a requirement for leadership skills. The requirement for teamwork skills cannot be overstated. Essentially, it's so important. You're working with a wide range of people, wide range of backgrounds, as I've said, so many different disciplines: nurses, healthcare assistants, porters, radiographers. Like, the system of healthcare is so vast, it requires support from all different types of people. And the reality is that no two doctors are the same either. They all have their own personalities, their own things. So not only being a leader, being good at, being a good team player, which means that sometimes you may have leaders in the team who are advising you, nurturing you upon what to do in particular situations. You have to be good within the scope of a team, helping your colleagues, all of these things. It's really important, and it's important to demonstrate that you've acquired these skills, gained these skills, and also put them into practice. Obvious ones is organization, time management, stress, ability to cope with stress, right? We've already discussed about all the difficulties, all the fact that you need so much resilience. Yeah. Look back on a time when you've demonstrated resilience on your life. How do you cope with stress? Yeah. How do you cope with these difficult challenges? What is it that you go to? Do you do some beneficial things that can help you with your stress? We've already alluded to a few of them earlier on. People have different hobbies, different ways of dealing with it. Organization and time management, of course, it's absolutely essential. All of these different pressures that you're facing at work, which we discussed earlier, you really have to be able to give a robust answer to demonstrate these personal skills. And the way in which you demonstrate this is through scenarios, things which you've actually done. Okay, so another important step is that, yes, the reality is that you've all done something which demonstrates these skills in schools. That's what most schools do. And even if you've only been focused on academics, there's definitely, the reality is that it's so vast, right? So the gold standard would be to have done many projects, many impressive endeavors and good things which can really demonstrate these skills. But I think more than that, it's more important not just to have really grand things which you've done. It's more about reflecting from those experiences, learning from those experiences. How can you implement those as a doctor? So not everyone needs to have made like a huge organization and taken part of these various different things. The reality is that it can apply to anything. Okay, so let's say you were anything, honestly. Like, you really need to get used to the skill of figuring out what the skills were which you learned from all these various things. Yeah, because the reality is that on the interview day, you may have to freestyle. That's the reality of the situation. You can't prepare for everything. They may give you a skill which you don't know, which you didn't know, but there was probably something prominent which requires that skill. You can give me any skill now, and I would be able to find a way that as a doctor, you need that skill. As a doctor, I've demonstrated that skill. Or in school, I demonstrated that skill through XYZ. I give you one example now. For example, I was a house captain, right? I don't know if it's in every school, but in large number of schools, you have a different house system. You have like around 4 different groups, and they do a variety of different endeavors, like physical, mental, like quizzes, and it's essentially you gain house points. You do various things like sports activities, etc. So I was the house captain, right? And I was organizing my house, which it extends 1/4 of the entire school, so that can be a huge number of people, and from a wide range of age groups, from year 7 all the way to year 13. And if you think about this, obviously you need to demonstrate all these skills in this role. So for example, time management, emotional resilience. Yeah, you may have had to deal with conflicts, difficult situations, communication. I had to give speeches in front of almost the entire school. Yeah, in fact, I did have to give a speech, many speeches in front of the entire school as well. Teamwork, liaising with different members of the team. I had to obviously be a leader. I had to make sure that I was able to give inspirational, motivational speeches at the conferences. Of course, organization, dealing with such a large logistical number. Again, this is an example of how I picked one example and I was able to bring forth all the skills that I came across. Yeah. And these are the main ones which they're looking for. There may be more, but the reality is that don't get flustered and don't think that, oh, I haven't done this skill, I haven't done that. You have. That's the thing. You just need to have those examples and you need to build that flexibility and that flair. And the reality is that you can apply your skills to various things which you've done. Okay. The main way to talk about different experiences that you've done and the skills that you've learned from them and how you've reflected upon them, right? So it's called the STAR method. This is something that you would have covered in the personal statement process as well in order to discuss your experiences. This is something that we teach in the StriveMed programs as well for personal statement. So the first one stands for S. It's a mnemonic, right? So it stands for S, situation, right? So you describe the situation that you were in or the task that you needed to accomplish, yeah? So it may be a particular role, it may be a particular job description which you had, or a situation at hand where you had to, perform a particular task, right? That's obviously leads me nicely into the next one, which is the task, yeah? So what was the goal that you were working towards, yeah? So what was the situation? What was the context, yeah? And then task, what were you working towards? What was it that had to be done? And then the next one is action. Yeah, so A for action. Describe the actions that you did to deal with that situation, right? Make sure that you keep the focus on you. I know a lot of people may be very hesitant to speak about themselves and what they actually did, but I guess in this context, you really have to demonstrate that you have those prerequisite skills and that you've demonstrated those skills as well. The next one is result. Okay, so R for result. So what did you accomplish? Yeah. And again, don't be shy to take credit for all that you've done. But the main thing is, what did you learn? What was the end result of the action which you did, right? So again, these frameworks, it's not to be robotic, but it's to understand the main result of what you're trying to say. You're trying to, essentially, even in medicine, we have something called SBAR process, yeah? And that's a framework of how to explain, how to give an adequate handover to your colleagues. I've already mentioned the on-call processes. And when you're giving a handover, yeah, so let's say you're finishing your evening shift, you're giving it over to the night team. They need to have a comprehensive understanding of the situation. What is it? What's the situation? What's the background, etc.? All of these things, right? Yeah, so the SBAR stands for situation, background, assessment, and recommendation. So all of these factors you'd have to tell to the on-call team in order, for example, what needs to be done next, what was the assessment, and what to do next, so that they have an adequate understanding of the picture. The idea is that you're not meant to be robotic and say, yeah, situation, this and that, but essentially it's just a basic concept. Just keep it nice and simple. Explain, paint the picture, what the situation was, what was your role, what did you have to do in the situation, and what were the actions that you took, what was the result of that, yeah? Did you succeed? Did you lose? If it didn't go as you planned, what did you learn from it? How did you develop your skills? The last R, it's a star with two R's. So the last one is called reflection. And this is very, very important. And it's very important as well to tie this skill back into medicine. So for example, if you dealt with a very stressful situation and that's how you learned how you manage stress, you apply and you reflect upon it. You realize that in your medical career, it's very likely that you'll have to employ these skills in order to deal with stress in the appropriate way. And you look forward to a career in which you'll be able to do that in a balanced way and lead a balanced, healthy lifestyle. So again, I'll give you an example of another endeavor which I did, which was when I was in school. I was helping facilitate the physical exercise classes of children with special needs. Now, this was obviously very, very difficult to do. It was more difficult, of course, than conventional circumstance because of the particular requirements and the things which you had to keep in mind. So I'm not going to go through the exact STAR framework with you. Now, my main point is to essentially emphasize right now is that how one situation can have so many skills involved. Okay, so for example, getting used to helping people, developing that idea of altruism, that caring nature, that empathetic nature, understanding the needs of various people, communication, yeah, sometimes especially when you're dealing with a big class, yeah, especially as well with individuals of special needs, special hearing requirements, speech requirements, sign language, things like this. Your communication is really tested. As well as this, your leadership, you're leading a large range of kids, diverse range of kids, and they all have their own specific needs. It's important to cater for all of them. And the next one is teamwork, right? So if someone said teamwork, yeah, okay, maybe I was leading the class myself, or however, you can still come up with an example of teamwork, right? The fact of the matter is that I had to liaise with the rest of the staff members at the school. I had to make sure that I got the curriculum exactly as they wanted it, based on the school curriculum. I had to liaise with the managers, the headmaster, the teachers, in order to get my curriculum correct, in order to understand the needs of them, in order to understand the various members of the school, the roles that they play, so that I can fit in the appropriate way. So rather than getting flustered and saying, oh, teamwork, I was just doing this myself, you can always come up with something. And that's the point I'm saying, is that it's not about lying as well, because obviously that's not correct. But the reality is that you just have to, don't underplay your experiences. Oftentimes you've done a lot more than you actually think that you have. Of course, overcoming challenges. There's a variety of different challenges based on dealing with children with complex needs. Sometimes they may not fully understand what exactly is being communicated to them. They may cause harm to the other kids as well. They may try to hurt the other kids. They may try to hurt you as well. All of these things you have to be wary of, but you have to be resilient in that light, and remember the purpose, remember the reason why you've come to help them in the first place, and always try to aim for the best outcome. And understanding would be emotional intelligence, and empathy would be to understand the frustrations of these kids with regards to their basic activities. For example, throwing the ball or these kind of things. They might find it more difficult. Some kids may find it more difficult than others, right? And so really being able to empathize with them, and the fact that these tasks are actually a huge factor for them, and the ability to do them to a good standard would mean the absolute world to them. And of course, the end result is helping them achieve a more fulfilling life, where they're able to do these activities and these physical endeavors in a more easy and a sustained manner. It has a huge impact on their quality of life as well, and their happiness and the ease of their family members, the carers as well. So overall, understanding the bigger picture and understanding the actual impact that you have been able to have, and the result, as I mentioned, in the STAR framework on these children as well. Now, the reality is that through this process, you've been able to explain how you've developed all these skills, and you've demonstrated them as well. Now you can apply that back to medicine, and you understand that medicine is all about achieving the optimal outcome for the patient based on their baseline, right? So the baseline level is very important, and it's different for everyone. You may have geriatrics, you may have elderly patients who they have a different level of baseline. Yeah, you may have patients with special needs who have a different level of baseline, but the idea is that there's an immense reward of utilizing these various skills of emotion, of empathy, of organization, time management, whatever you were asked to discuss, but you would say there's an immense reward in using those skills. And I would really appreciate the opportunity to use those skills in a medical setting and help patients as well achieve the best possible outcome. Okay, so the next topic is work experience. And we've already discussed how important it is to have an adequate range of experiences away from the desk, away from your academic work, in order to understand and gain a realistic desire of medicine, and whether or not you want to pursue those challenges in order to reap the rewards of being a doctor, right? So again, it's important to have a balanced approach with regards to this. So some people would say that you can just take any work experience and you can spin it into saying that you want to do medicine, right? Even if it's not relevant at all. Again, there is some truth in that, but the actual truth lies somewhere in the middle, right? And some people would say, for example, on the other end of the spectrum, that you really need to do like the top work experience. It makes a huge difference. You need to do the most, it may say like you need to do the most prestigious specialty. You need to do at least X amount of months and this and that. The reality is that the accurate answer lies somewhere in the middle. So yes, it has to have some realistic crossover. I mean, that's the most beneficial, right? If you're not able to achieve that, then that's one thing. But a realistic depiction and demonstrating to the interviewer that you've seen something which is close to the real thing. For example, let's say you're at your desk and you haven't had much experiences. You may be good at academics, but you may not know truly what awaits you on the other side when you graduate from medicine and we actually work as a doctor. You may struggle to have an accurate representation and demonstrate that accurate representation as well, or demonstrate your passion or the fact that you're ready to overcome the challenges. Now compare this to someone who's done long hours in the workplace. Let's say they've shadowed a doctor, a junior doctor. They've done long hours. They've been with the doctor while they're on call, for example. They know the struggles, the stress, all these things that I've spoken about. They've actually seen it. yet they still want to do medicine, right? They still want to make their sacrifice, which I've said earlier. That proves that someone's really, really interested, and he really understands what he's signing him up for himself or herself up for. Now, it's important to realize is that there will be a large proportion, a significant proportion will have a harsh reality once they start working as a doctor of how hard it actually is. This is the truth of what happens to many, many medical students. So maybe even they've got through they've got through their places in the medical school interview, they've got through medical school, but then the real thing is it can be a harsh reality for many people because of how hard it is. They weren't ready for all the sacrifices that they had to make, right? You don't want to be in that situation first and foremost. So this is greater than just passing an interview. This is genuinely seeing if you're ready for this, right? Getting the interview and getting the work experience. So the fact that many medical students themselves still have a harsh awakening once they start working as a doctor and they realize the intensities, that shows that you have a clear-cut area where you can enhance your application and your strength as an applicant to medical school. Because the fact is that many people don't have a realistic understanding, and you can really shine in that area by showing that you have that realistic understanding through your work experience. Again, it's always important to show that you've seen a realistic understanding. So even if you weren't able to get as much hands-on experience or as much realistic experience of the exact job that you're doing, let's say even if you're shadowing, let's say administrations officer or a secretary in the GP or a receptionist, right? A lot of the times the receptionists will actually face abuse from the patients, and they have complex demands. They're struggling themselves. A lot of that stress gets carried out onto the receptionists. Unfortunately, it's not a good thing, but this is the reality of what happens when you're working in that environment, that tense environment, and you can then start to see what they go through. You can then potentially consider what doctors may go through as well, and the stressful and the complex situations that they have to deal with and that stress that they must endure in order to go through that, right? So again, linking that work experience, understanding that you have a realistic picture, demonstrating that you have a realistic picture of what it's like to actually work as a doctor. There's not only that, so obviously the challenges aspect, as I've mentioned, the realistic, but then you have to show the desires, realistic desire. Why is it that you still want to do it despite these challenges? So again, you may have seen the amazing things which can come from working in this profession. You may have seen, as I've already alluded to, patients getting better, etc., etc. So all of those stories you can use to your advantage using the STAR approach again. So in the STAR approach for the work experience, first and foremost, I don't want you to get too hungover on what work experience you've done. As I said, make it as realistic as possible, make amazing reflections from that. That's the most important thing. It's not about necessarily going to the most prestigious ones, okay? Just do what you can, do the best that you can, gain the best work experience that you can, the most accurate. But it's not necessarily about how long you've done it, who you did it with, etc. It's about gaining the fair and accurate reflections from that, right? Insightful reflections. And they also have to come across as genuine at the interview. And this is where you can use your personal skills to demonstrate the fact that you're genuine and sincere in your desire to pursue a career in medicine. One example of this is the COVID pandemic, when obviously things were different. We were living in situations of lockdown, work experience opportunities were limited. So imagine the creativity that students would have had to employ in order to demonstrate their work experience during that time. So there's many different things, like teleconferences, video conferences, all of these various different things, remote clinics potentially. So it's really about being creative with your experiences, seeing what experiences really made you think. And it's not just about, oh yeah, I did 1 month in such and such place. What did you see in that place? Even better, did you have a chance to contribute? Did you have a chance to do something there, right? So for example, I'd like to discuss with you, let's say one of the experiences which I did was 2 weeks of shadowing in an intensive therapy unit. This was in one of the NHS hospitals, and you learn a variety of different things there. For example, critical patient care and intensive patient care practices. You gain an insight into the teamwork and the investigation skills of dealing with patients of a critical nature. And I really saw how each team member's contributions were valued greatly in the multidisciplinary team. I was able to contribute by holding a few items while transporting a critical patient for an urgent CT scan, which they had to have. This showed me the importance and filled me with amazing excitement for even the less glamorous side of medicine and the more challenging side of medicine. Also, I was able to appreciate that the patient outcome for each and every patient may not be what exactly we want. However, it's very important to be there for the patients and their families during their times of need and make this situation more palatable and easier for them to handle. Another example which I had was when I was working with a pediatrics consultant. I was working in his clinic, and oftentimes you may have children with complex medical conditions, and you really have to explain it to the parents. They may be distressed as well at times. So again, you can say that sometimes you, for example, one of the things which I said was that I helped to relieve the distress of the patient. I was able to help with a language barrier, but that just shows that you understand that you have to really deal with these complex emotions as a doctor, as well as the fact that there was an immense reward in caring for these patients and making sure that they have the optimal outcome. As a child, any health problem it's very, very important, and it can carry with them for the rest of their life and shape the rest of their life, to be honest. So just being in that position, something that I really reflected upon heavily, and I'd really want to take that forward in my medical practice. So again, you really have to link it back to the fact that why you want to be a doctor, make the challenges, apparent as well. Make, if you can, say what you've done during that time, as in how you contributed, because it's always good to show initiative, right? You as a person, this is a general rule of life. You as a person, you want to be someone who leaves good wherever you are, right? You want to be a beacon of light for others. That's the crux of the matter. So you showing that you've taken initiative, even if you're doing work experience, that's a really great way to show that you care and that you want the optimal outcomes for the patient, right? Technically, on work experience, you would be fine by just standing there, but to go the extra mile, help the patients, help the team, even if it's helping the team with their morale, it's very, very important, and it does actually go a long way for patient outcomes as well. So we've come to the end of the course. Congratulations for making it this far. And I'm sure that this was an exceptional use in order to prepare you the best possible way that we can. If you want further advice, further coaching from us, we're more than happy to help you directly. You can just contact us on strivemed.co.uk. You can partake in one of our packages as well to get one-to-one tutoring and mentorship from us. We have a wide range of tutors. We have a lot of medical students. We have doctors working with us as well. So it's very important that at the end of the interview, you finish off and just demonstrate your humility, and demonstrate, again, it's your last chance to show genuine desire, as I've mentioned, and just say, something along, obviously for the MMI station, it's a bit brief because you have to move on very fast, but still you thank them, you employ the appropriate, nice manners, good gestures as well. And in the traditional interview, it's your last chance to demonstrate, again, your realistic desire, and just say that, thank you very much for your time. I'd really appreciate the opportunity to join this university and to have a positive impact on the community. Something basic like this, it really leaves a nice taste for the examiners as well. The main thing after your interview is to stay positive. Try not to overthink it as well. As I said, resilience is a key part of the medical journey. It's very important to demonstrate gratitude. We should always have that gratitude mindset. Things may not have gone how we liked, how we wanted them, how we expected them to go, but essentially we have to trust and understand the fact that wisdoms for things will be apparent later on. Whether you get in, whether you don't, you really have to just maintain positivity, especially you're waiting the results. They may not come immediately. Try and be as positive as you can and move forward and make sure that you fulfill the rest of your tasks, right? It's not an easy journey. You're still going to have exams and all of these things to study for, and it's a lot of mental, you really need to tell yourself, okay, it's a journey, okay, it's kind of like a marathon. You have to do one thing after the next. So just keep yourself mentally strong, mentally resilient, overcome one hurdle after the next, and just start focusing on the next thing which you have. So I'm sure you do really well, especially after you've come to this level of the course. It's important to mention that, of course, if things don't go your way after you get the results of the interview, it's not to lose heart. As I've mentioned, the importance of resilience multiple times. People have so many different paths to medicine, and you just have to stay persistent, stay consistent as well. I'm sure that if you've done this interview course, you would have a significantly enhanced outcome. And we have a wide range of services as well on StriveMed.co.uk. You can check out our services. We're more than happy to help you. And thank you very much for watching the course. And all the best with your journey. That's it for myself, Dr. Inaam. Thank you very much.